It is my pleasure to have here my friend from Sweden and old friend, more than 20 years now, Professor Peter Nilsson, who is going to talk us about war and hypertension. Thank you very much, Peter, for coming, and I'm looking forward for your lecture.
Thank you very much. Can I have my slide? Good afternoon, everybody. We are running late. I will be brief. If you want my slides, you can have them for free, because some of the slides are not easy to see and I cannot show all my slides. But if you want them, they are free for you. So we live in an era of conflict and wars, and it comes very natural to address hypertension in this perspective. We know that the war in Ukraine is ongoing and that many people suffer, not only from war injuries, but also from the consequences of poor health services. This is to show you that the colors of the flag in Ukraine and Sweden are the same. So we are allies and we support Ukraine. The topic of war and cardiovascular disease has been studied for a few years now, and I will just briefly review this topic with you. For example, in the United States, there have been some investigations in the so-called Gulf War veterans from the 1990s, and they are aging faster. This means that they are developing hypertension and cardiovascular disease to a higher degree than expected. These are the consequences of war for hypertension and blood pressure control. First of all, blood pressure tends to increase temporarily or permanent. There is also irregular medical contacts and infrequent scheduled visits for control. So control is going to be impaired. Lack of antihypertensive drugs in war zones because of blockade and less supplies. Increased risk of cardiovascular comorbidities that has been shown during long-term follow-up. And another aspect is also the early life programming, prematurity, growth retardation, and in the future, increased hypertension risk. In Ukraine, it has been reported that many pregnant women risk to have premature babies or growth retarded babies because of the stress of the war. And that could bring some increased risk for hypertension and cardiovascular disease in these children born today in the war zone of Ukraine. One of the very first studies on this topic was published in the Lancet in 1945. There was a medical officer from the British Army, Captain Graham, and he investigated the increase in blood pressure following exposure to battle. So he measured blood pressure in soldiers coming back from battle and combat. But after some time of rest, the blood pressure decreased again. So it was a temporary blood pressure increased in these soldiers. One of the first reports. More lately, there have been many studies on the consequences of the psychological trauma and the stress exposure of war for blood pressure regulation and risk of cardiovascular disease. I just show you the slides. I would like to emphasize that if you search for PubMed, war and hypertension, you will find many interesting studies. In the United States, they did a follow-up study including more than 55,000 responders for the risk of developing hypertension during follow-up. And as seen on this slide, people who were deployed with exposure to multiple combat episodes had increased risk of developing hypertension. The incidence was increased 6% as compared to controls. This was especially evident in the more elderly soldiers than the younger soldiers. Why? Because these elderly soldiers probably had families and more worries about their spouses and children, etc. Another study published in Journal Hypertension 2020 could show that there was a dose-response effect on blood pressure and hypertension based on the number of combat episodes and whether the soldier had been injured or not. So a soldier exposed to many combat episodes with an injury, with a war injury, had increased risk of hypertension because that was a marker of the stress exposure. Let's go to the Falkland War, the Malvinas War, as it's called in Argentina. That was in 1982. I guess you remember this. And in Argentina, there was published a study with a follow-up of Argentinian soldiers, veterans from this war. And in this column, you see the ex-combatants, the former soldiers. And here we have the controls. And I highlighted here that the risk for hypertension, metabolic syndrome, and myocardial infarction was significantly increased in the ex-combatants, the former soldiers, as compared to controls. Another aspect is also impaired healthcare services. This slide will address the problem with dialysis and taking care of kidney replacement therapy patients. There are many such patients, and because of the war, health services are not functioning very well. In fact, they face problems. This has led to a consensus document published by the European Renal Association about armed conflicts and kidney patients, a consensus statement from the Renal Disaster Relief Task Force. So this means that during war times, this specific group of patients should be taken well care of because they suffer a lot if they cannot have their regular health contacts and dialysis. This is a systematic review on the exposure to violence and future cardiovascular health risk. Especially exposure to violence during childhood has been associated with increased risk of cardiovascular endpoints in a number of follow-up studies reviewed in this paper. On this slide, you can see a solid line, children with exposure to war and conflict as compared to controls. This is event-free survival. So it means that children exposed to war and stress had increased risk of hypertension. And that was even more so for the children exposed to war and stress in very early life, below the age of 2 years, as compared to other children. So the younger the child, the worse it is for risk of hypertension, and that is also true for cardiovascular disease. We know that women exposed to stress, famine, malnutrition, and health hazards risk to have low birth weight babies adjusted for gestational age and prematurity. I will not go into the details because lack of time, but I want to mention that during the siege of Leningrad, a lot of children were exposed to this, and there have been follow-up studies in Russian. This one, according to the risk of hypertension and cardiovascular disease in these survivors. Especially women who were 6 to 8 years old and men who were 9 to 15 years old during the siege of Leningrad had a higher systolic blood pressure during follow-up. So there are different time windows, not only during fetal life and early life, but also like in pre-puberty. The war in Biafra, coming soon to the end, Vasilis. I don't know if you remember this. It happened in southeastern Nigeria, end of the 1960s, a horrible civil war. And some researchers of today, they have traveled to Nigeria to make interviews with people at marketplaces of today in southeastern Nigeria, asking them, when were you born, where are you born, may we measure your weight, blood pressure, and blood sugar. And in summary, this was the finding that children born during this difficult civil war period had higher blood pressure, also higher body weight, and higher glucose levels. I jumped some slides, and finally, I just want to mention the problem of separation. Because during war, many children are separated from their parents. This is a picture of Finnish children. About 80,000 Finnish children were sent to Sweden because Sweden was neutral and not at war during the Second World War. Many of them could not speak Swedish. They had their names on a piece of paper hanging around their neck. So during follow-up, it has been found that many of these children in adult life have suffered from depression and also cardiovascular disease. So in summary, I wanted to review with you the very important and very actual problem of war and conflict, stress exposure, of the risk of hypertension. Not only the stress exposure, but also the lack of drugs and missed follow-up visits means a lot. Early life influences of today may impact on the cardiovascular risk of tomorrow. So finally, restoring peace and providing good medical services is the only way to counteract this problem. Thank you very much.
Thank you very much, Peter, for this clear and interesting presentation of the effect of war in cardiovascular health. Is there any question from the audience? No, if not, is there one? No? Okay. If not, do you believe that...
If I may ask you a question.
Okay.
We are in Greece, and Greece suffered during the Second World War, but also after the war. There was a civil war and some bad episodes in history. I just wonder whether anybody has bothered to make a follow-up of some birth cohorts born during these difficult years. I don't know.
I'm sorry that, but we don't have this data because in Greece the statistical the people that are having statistical data started from 1960, so we don't have data before that. So it is difficult to have only follow up. Only if you can follow up patients with from born in between 1940 to 1949 and compare them to the next decade, which is something interesting for future studies. Thank you very much, Peter. Thank you very much for coming, and thank you very much for the excellent and your talk in 10 minutes, but a wonderful talk.